majors that we've put out. So.
Okay.
Melissa, can you speak to the money that's in the CARES Act? Can you talk about what types of things that money can be used for?
Yeah, so in the CARES Act for grant-based service coordinators, we are not sure 100% what that money can be used for just yet. They're supposed to put out guidance in the next 2 weeks, but based off of the guidance that came out for budget-based service coordinators today that Evan talked about, we think that it's going to be able to be used for the same things. So like PPE, overtime pay. If you're a part-time service coordinator now, they can make you full-time temporarily. Or other things are IT and office equipment. IT would include like those types of software that I'm talking about with Ask Online, like, you know, call in or text, or even something like Ask Online that's a case management system so that you can have your files electronically. So all of those types of things are what's going to be included in the budget-based service coordinator allowances. And so we're thinking it'll be for the grant-based too. So for grants, real quickly, you're going to get your money through a notice of funding award, and that's going to just be added to your grant solutions account or your ELOCS system. And then if you are a budget-based service coordinator, your company is going to have to request those funds through a form for you, and there is a cap on those funds. It's $3,000. If you're grant-based, you're going to get on average about 9% of what your grant was last year is what they're going to be adding to your account, but you do have to accept the money if you're a grant-based service coordinator. So make sure you're on the lookout for that so that you're accepting those awards and that your company, if you're budget-based, is asking for the money in their forms. So hopefully that's not confusing because there's 2 different processes, but we actually have an email going out in 15 minutes. It's going to explain both of them. So if you're on an Ask member, you'll get an email explaining all of it.
Okay, we have a question.
Thank you.
Chat. Oh, sorry, sorry, Tonya. We have a question on chat. It said, when the information is collected from the residents, are the residents aware the information is shared, and should they sign a release?
Yeah, so with Ask Online, you don't have to get a release from your residents because it really is just your electronic file. And so that is your information. And as far as us using the data, we're okay to do that because it's all aggregate data. So we have no way of going in and finding out, you know, what an individual property is doing, what's happening with an individual resident. The Ask Online information is all high level. You can check for every single service coordinator in the country, everyone in every state, but you can't just go into a property and look at someone's file. So it's completely safe. And you don't have to worry about a confidentiality agreement specifically for Ask Online.
Okay, great. That was a good answer. Oh, and thank you. Okay, does anybody else have any questions for Melissa? Okay. Well, thank you, Melissa.
Thank you.
And I think Melissa's going to hang around for a while. So if you do think of something, put it in the chat. And at the end of the session, we can go over some more Q&A. And I just wanted to mention that somebody that works with Melissa and actually works with Evan and I, Kendra Keene, who she works with Bill Benson, who you all met yesterday. Most of you met yesterday. Is actually sitting in on the session too. So she's one that participates in a lot of the congressional conference calls that Evan and I do, and we partner with Ask on those. So she's advocating for a lot of the things that Melissa just went over in our calls. So anyhow, we're part of that process too. Always advocating for our service coordinators as well as our residents and staff. All right. So we're going to open it up. We're going to turn it over to Tonya Balducci and Maria Medley from SPM. I think we'll go for a little bit. And then when they feel appropriate, maybe we'll take like a 5-minute break and then do the second half. So whenever you all think is appropriate to take a quick break, I'll let you decide.
Okay.
Welcome, Tonya and Maria.
Hi, everyone.
Thank you. Well, as Janelle said, we are the quality assurance directors for SPM. We are based out of, I'm based out of Birmingham, Alabama, and Maria is based out of Florida. We just want to thank you guys for inviting us to speak today. And thank you so much for everything that you're doing right now during this time. We know that it's not easy right now. And so we just want to thank you for everything that you're doing. So I'm going to let Maria start.
Great. So we are going to start by talking about the new normal with service coordination. And like Melissa was saying, you know, there was that vulnerability tool that AASC developed. And here at SPM, we kind of mirrored what was developed by AASC and used that heavily to influence the one that we created here for the company, only because it asked other questions that were not included in the Ask Online version, and it was a little bit easier to use. It included just simple yes or no questions rather than the scoring system. So this is an example here of what ours looked like. And, you know, it was very useful to have that other one to kind of mirror based on what we did. So the purpose, of course, was to identify residents that were more at risk, you know, to kind of have negative effects of COVID or isolation, and just to help us, health service coordinators, prioritize those residents with making phone calls and making sure they had enough food and medicine, or, you know, they had seen their doctor, they knew who their doctor was, and maybe kind of have a schedule set up so they could conduct more frequent follow-ups on those residents. So we had initially set it up. And we know it was a lot at the beginning. If anyone scored higher than a 10 on our tool, they would get 2 calls a week, but everyone else was getting a once a week call. So, you know, that was something that our service coordinators were doing. And the purpose of the scoring, again, was just with a yes or no. And if there was a yes, it kind of highlighted it for them to kind of focus on questions like that when they were speaking with the residents. So that led to the wellness calls. Tonya, I believe.
Yeah. So with the wellness calls, like Maria was saying, the vulnerability assessments allowed our service coordinators to determine how often they would call that particular resident. So the higher their vulnerability score was, the more frequently we would call them. And with the wellness calls, the purpose was to identify those residents and contact those residents that maybe were more at risk and might need a little bit more help or guidance during this time. Our service coordinators were having limited face-to-face interactions with the residents, so we relied heavily on conducting these wellness calls. Maria and I put out some guidance about types of questions to ask during the wellness calls. So many of our service coordinators were used to doing everything in person. So having to kind of switch gears and adapt to wellness calls took a little bit of time to get used to, but they were able to do it and it was great. But so some of the questions, we recommended that they ask them like open-ended questions so that way it allowed the residents the ability to elaborate on things. So it would be questions like, you know, how is your day going? How are you managing your diabetes or whatever other chronic condition that resident may have? We would ask them, you know, how are you handling the social distancing policies and protocols? Are you still staying connected with your family? So just questions like that to where the resident could elaborate and not just give yes or no questions. But of course, throughout the calls, we would do the basic service coordinator things as well, like identifying if they had any needs such as food or medication or health needs or anything like that. And of course, we took care of those while we were on those calls. We also looked at the wellness calls as an opportunity to educate the residents about what was going on with COVID. So we used it as an opportunity to update them on any local ordinances that were being put out in their area, any rules that were being put out with the actual building, and just shared resources with them, talked to them about the importance of social distancing, just to kind of remind them and keep them on track of what was going on. And then we would ask our service coordinators to write up and just document that they had spoken to the resident, and then just kind of give a summary of the topics that they discussed. So those were the wellness calls. Of course, we also did our regular assessments via the telephone. I know every company does things differently. With our company, we assess all of our residents at least once a year. So we had to switch from going face-to-face, doing our assessments, to over the phone. And basically we were still doing the same things. We were still assessing their ADL and IADL needs. We were looking at what their current health situation was, what types of benefits that they had versus what they might need, what their support system was or lack thereof, if they had any changes over the last year, and then any other needs that they might have that we identified during the assessment. We would also update their cost savings, look at their intake profile and update that information if it needed it. And then of course, update release of information forms. So we were still able to do everything. It's just, we had to do it a little bit differently and utilize the telephone a lot more than we ever have before. But our team did a great job. They adapted very easily, and I think it worked out well for them. So next, I guess, Maria, you're going to talk about social calls.
Yes. So the protocol that we put out, it was a document for service coordinators to not only know how to use the vulnerability assessment tool that we had in the wellness checks, but we also try to provide some education on what social isolation is and loneliness. So with social isolation, it's more of an objective quantitative measure, usually dictated by, how big the social network is of a resident, how many friends they have, how often they engage in outside activities. While loneliness is more of a qualitative subjective measure, how they feel, because someone that may not be as active in the community, that may have limited number of friends, may not feel lonely. They might be satisfied with what they're doing, or vice versa. So we wanted to kind of help service coordinators identify the differences and include that when they were doing the social calls. We know that social isolation and loneliness can have negative effects on older adults. For example, they put them at an increased risk of cardiovascular disease, hospitalizations and readmissions, falls, suicide and suicidal ideation, even worsening dementia, decreased immune functioning, things like that. They're so crucial at this moment, especially during the pandemic. And, of course, we tried to guide our service coordinators on how to help reduce the negative feelings, the negative effects of social isolation and loneliness. And one of those ways to do that was to do these social calls that were supposed to be integrated with the wellness calls. So on these calls, we would ask service coordinators to ask about how they were feeling, just keep it more upbeat if they wanted to share something that made them smile that week, or just lend an ear if there's anything that they want to talk about, things that we're doing differently now that they have social distancing in place, how they're managing their days, just things like that to keep it social, keep it going, and keep that rapport going as well. So overall, it was well received. We did survey some residents, and it turned out to be a really positive initiative. Residents were satisfied. Of course, some were bothered by the calls and, wanted to limit the number of calls they were getting, seniors, everybody's different. But overall, it was very well received, the protocol that we put out and the way that residents received it. Let's see.
So I have a question.
Yes.
So with those social calls, you said there were some residents that seemed bothered by it. So did they have the ability to opt out?
Yeah, they were opting out. They were communicating with the service coordinators that they did not want to receive the calls anymore. And, most service coordinators just respected that decision and just put in their notes that they did not want to be bothered every week, or maybe wanted to be contacted once a month or not at all. So it was really up to the resident. And we did put out a survey when things were when service coordinators kind of returned to the office, because at some point they were working from home twice a week. And we just kind of wanted to know how service coordinators felt about the survey, that the protocols that we implemented. And most service coordinators believed that these protocols that we implemented were beneficial. They agreed that the vulnerability assessments were necessary. They appreciated the wellness checks and thought it was useful, and along with the social costs as well. And we also asked service coordinators if they were willing to come up with innovative programming to keep the residents engaged while maintaining social distancing. And we're going to talk a little bit more about what some of our service coordinators did to kind of keep that going. So this, this is a quick snippet of the survey results that we sent out to our staff. One thing that we're piloting here is that we're using free conference calls online to connect the residents. So what we're doing is that we're sharing useful information at first. So for Florida, particularly hurricane preparedness sessions. And at the end of the session, we are having some games that we're playing. One of the games that we played was to play some oldies and have residents kind of guess the name of the song and the artist, and submit those to the service coordinator. Maybe that could be featured on the newsletter or win a prize. The first call, we were hoping for 3 residents to join in, and we actually had 12 residents join the call. And, it was very positive. Everybody got some important information, and they really enjoyed the game at the end. So we're trying that again. Actually today, we're doing a phone bingo. We'll have a health presentation at the beginning and then do a phone bingo later on. And the way that it was organized is that residents signed up to participate. And the day before, the service coordinator printed out bingo cards that she distributed to the residents that wanted to participate. So I will find out today how it went and maybe share it with you guys, share it with Janelle and see who's interested in getting the results of that. And some people were getting creative with newsletters, sending out coloring pages and having contests, or putting out useful information. Tonya, I think she had some great things that her staff did, if you care to share that.
Yeah, they, I don't know if all of you had similar experiences, but a lot of our residents were and still are upset because the community rooms are closed down. They're not able to get together and do all the things that they are normally used to doing. So we had to kind of get creative a little bit and figure out different ways to get them engaged, but without getting them all together and following social distancing protocols. So some of the service coordinators started using their newsletter as an outlet to provide some creative things for the residents to do. All of our service coordinators will put out a monthly newsletter that typically has things that are service coordinator related, talking about what programs they have, if there's any new benefits or programs in the area. So it's just a newsletter that really pertains to service coordinator things. So our folks were putting, word searches in their newsletter. I had one that she would include 4 misspelled words in her newsletter, and the residents were supposed to find what words were misspelled, circle them, and the first one to slip it back underneath their door got, a prize. I had others that did, coloring contests that were included, or a page to color was included in their newsletter, and they had coloring contests. So they just tried to think about different things that would get the residents engaged and give them something to do so that they could kind of get it off their mind that they weren't able to get together and congregate downstairs, in the activity rooms. I had another service coordinator. She was very creative. She got a local home health agency to come to the building But this building is not a high rise, it's different cottages. And so the home health workers stayed outside, but they brought special markers and they played tic-tac-toe with the residents on their actual windows in their apartments. So they were still able to follow social distancing guidelines, but yet it gave the residents something to do, and they thought it was the greatest thing that ever was. So of course, if you're in a 14-story high-rise building, that's not going to work for you. But, you know, for those buildings that are not laid out like that, you know, that was definitely something that the residents really liked. You know, the other thing that we kind of stressed to our service coordinators during this time was, you know, utilize this time to work on your partnerships within your community. Because we weren't seeing residents and doing almost everything over the phone, you know, it gave the service coordinator some time to focus on, you know, establishing different partnerships throughout the community. And so we asked them to network and document their efforts. You know, and in addition, the property-wide profile is one of the reports that'll be due, you know, this fall to HUD. And in that property-wide profile, they're talking about, you know, what types of networking that you have and how many partnerships you have. So we asked our service coordinators to kind of utilize this time to go over that. Maria, did you want to say anything else about partnerships or anything?
Yeah, so some of our service coordinators are very successful with partnering with local clinics and health departments. They actually got these organizations to come in and test everyone in the building, including staff, for COVID-19. So that was one of the biggest successes with networking that some of them achieved. And also we saw an increase in donations, especially with food donations, partnering with agencies such as Feeding Tampa Bay. So it was really great to see that. And other organizations and companies donating goodie bags with household items, toilet paper, you know, toothbrushes. Some of them are donating grab-and-go lunches, having social distance ice cream socials where they come down and maybe 3 residents at a time come and get some ice cream and a pamphlet with information and to just go back up to their rooms. So it's just a matter of getting creative, reaching out to the community, talking to existing partnerships, and you'd be surprised how many people are actually willing to help and donate things to the residents.
I do have a question. Again, because this is something we have talked about in our weekly Zoom check-ins with the building staff. How did you get a whole building tested for COVID-19? Because we have been told the buildings that our B'nai B'rith buildings that have looked into this basically said to do that, they would have to open it up to the public. I mean, they would become a testing site. So that's kind of interesting.
Yes, so that was true for some buildings. People from the community were coming in to get tested, but others, they were able to just work with the health department and other clinics that actually reached out to some service coordinators as well to get those clinics to come in and test everyone. So yes, it took some effort from the service coordinator to reach out and establish those partnerships, but also really it was just depending on the city and the available funds the city had and what resources they had to be able to do that. For example, in Miami, that has not been the case. It's been very difficult to get anyone to come in to the building, even to test just one resident, because tests are limited on a daily basis. But other cities like Jacksonville, there was a lot of resources there, and service coordinators were able to take advantage of that. So it really kind of varied depending on location as well.
Mm-hmm.
Okay, and did everybody participate? Did you have a good participation rate of the buildings that did do it?
At the beginning, not so much. But later on, as things progressed and we saw an increase in cases, more residents were willing to come down and participate in the testing.
We had a property in Chattanooga, Tennessee that also was able to provide COVID-19 testing for the entire building. And that service coordinator partnered with one of the local home health agencies that already does a lot of things for the building. And they were able to come in and the residents had to sign up if they wanted to get tested. That property probably has about 100 folks, and I think there was about 80 of them that actually got tested. Our biggest obstacle that day was getting all 80 people in and through the test and making sure that we were still social distancing and not having all the residents down there at one time. So what we did was we just did a floor every 30 minutes. That way there would only be about 9 people down there at a time, and we were able to space them apart. But it was very well received. We did not open it up to the community. It was just there for the staff and the residents of that particular building, but it was very well received.
Because I think one of the issues I think that at least we've been involved with was they were going through the local government. So that's a good point, going through, you know, healthcare providers, maybe that are already in your building.
Mm-hmm.
Right, but you also, you know, have to be involved as to what kind of testing they're providing. We had a building where clinics were approaching residents saying, oh, you know, we can go to your building and pick you up and test you for COVID and then bring you back. And of course, people were interested. Later, the service coordinator found out that they were not being tested for the virus. They were being tested for antibodies. So if they got a negative result, residents assumed they were negative for COVID, and they were less likely to practice social distancing. And, you know, we're kind of skeptical about what that clinic was doing. So, you know, even though they're willing to do it, just kind of follow up and see what exactly it is that they're testing for, and what their intentions are. Like always, just being careful about who comes into the building offering testing.
So next we're going to talk about Rapid Cast and Resident Connect. Melissa did an excellent job explaining, you know, what Resident Connect is. Rapid Cast is another tool like Resident Connect that some of our properties use. But basically, it's just an excellent way to make sure that you are communicating with your residents about whatever it is that you need to communicate with. So if you don't already have something like that, I would definitely recommend that you or your management staff or whomever look into that, because it can be very beneficial, not just for the residents, but also for the service coordinator and the management staff, because they know they're getting the word out to the residents that need to know what's going on. So
yeah, it's something we're really excited about. We have had positive feedback from our vice president here in Florida that thinks this program will be beneficial. So we encourage service coordinators to talk to their managers and, you know, talk to them about the benefits of this program and how useful it would be to connect with the residents. And it's a huge plus that a lot of the things that you do through Resident Connect will also go directly into your notes, which would save a lot of time and grief given everything that's happening. So I think it's a fantastic program, and we're definitely going to look more into it and getting a lot of the service coordinators here with us set up with that program in their Ask Online.
Oh, and we did have somebody on the chat just made a comment, and this is going back to the testing. They were told to work with their neighborhood health center, but they said it wouldn't be a good use of resources to do a one-off of testing one building. So they're still staying connected to see what can be done, but clearly it is different everywhere.
Yes, it is. It really has been different everywhere. It is true. So it's, you know, people are trying to reach out, but it's also a matter of luck and what resources are available in that given county or the city, depending on location as well. So that's unfortunate, but reaching out, you might get lucky, and maybe a private clinic may be able to do it. Okay, so the next thing we're going to talk about is professional boundaries, especially when working from home or working remotely and not being able to use your phone that you have in the office. So Tonya. So some of our service coordinators were using Google Voice when they were working from home. They were downloading the app and using that to call the residents, so they didn't share their personal phone number when they were making these wellness calls or social calls. Some people didn't feel comfortable with Google Voice. They were using other apps. Some try to use WhatsApp, but again, that would share their personal number. So we're discouraging service coordinators from using that. But that is a good suggestion. The things that we saw people using. So if anyone was wondering how they could still communicate with residents while working remotely, Google Voice is a good option.
Mm-hmm. And it was great too, because like Maria said, we had service coordinators that were working from home and didn't want to use their cell phone to call the residents, because then of course the resident would have their cell phone. So we set all of our folks up with that so that they wouldn't have to utilize their cell phone, and the residents wouldn't have to know what their number was. So
so we'll move on to a big challenge faced by service coordinators, at least our service coordinators, which was maintaining those professional boundaries while working remotely. And especially those service coordinators that have in mental health, there was some temptation at times to kind of diagnose residents with, you know, feeling depressed or having a bipolar episode and things like that. So we just wanted to point that out, just to be careful from making that type of diagnosis. And I think Tonya was going to talk about that a little bit more.
Yeah, we always encourage or remind our service coordinators that they're not clinicians, that they do not diagnose. Of course, they can document the behaviors that they observe, but they're not clinicians. And so when they see behaviors that they feel like need to be explored and checked out, you know, they need to make some kind of referral or call family or do something, but we're not just going to up and say this resident is depressed or this resident has dementia or whatever. Some of the resources, Maria and her folks had a lot of success with doing the telehealth appointments. Maria, do you want to speak to the telehealth appointments that y'all did?
Yes. So some of our residents were able, and through the insurance, actually Humana was one of the ones that I talked to. They are covering telehealth services, and that includes mental health. So if they should check with their insurance and see if it's covered. But the representative was telling me that most insurance carriers at this moment are covering mental health services through telehealth. So if they have a smartphone, you know, or a computer at home, that's something they could benefit from, and just, you know, the service coordinator would try to get in and help them set up the appointment. And I actually wanted to ask Melissa, with the HUD money for the service coordination, COVID-related expenses, would service or the property be able to purchase maybe a community tablet that would get sanitized between uses so residents could do some telehealth appointments with their physicians or mental health counselors?
I haven't looked into how properties can use the money as much, so maybe Evan has looked into that. But for the service coordinator line item, it just says office supplies or IT. So you could maybe try to make the argument with your regional folks if you're grant-based, or that would be IT. But it could maybe come out of the properties budget instead of the service coordinator budget. And so yeah, I don't know, Evan, do you know if something like that could come out of the property money with CARES Act?
Are you talking about, IT needs?
Yes.
Yeah,
That's why I just wanted to make sure. So yeah, I think that is just a quick review now as to what they count as like things that you could put in for funding. Increased frequency of cleaning and disinfecting common areas, intensive deep cleaning, office technology, and other equipment needs to facilitate social distance. So guessing that's going to be the one that it would potentially come under. But considering that this just came out now, I'm not sure that HUD has fully fleshed this out, understandably so. I'm guessing that, a lot of different buildings will probably apply for Wi-Fi under that. And we'll see which way HUD comes out on this. I think that's, I suspect that HUD would probably have a ruling for across the country as to how they're going to apply that.
Well, Evan, also what they're talking about, the question really was, and this is something that we have been advocating on our congressional visits, is getting a tablets for the residents to use.
Yeah, I think it would seem to me, given the amount of money that they are allowing per building, it would seem unlikely that they could absorb that type of expense. So I think the limits on the amount of money that they could use are about, you know, it says here $2,000 base per property. So, and there's some other criteria as well, and there are ways to go above it, up to 3,000 for additional allowances for properties with a budget-based service coordinator. But to get everybody in the building a tablet, that's really going to blow past.
Oh yeah, no, of course. It would be like a community tablet just for,
Yeah. Yeah, and that's, we've been advocating, especially AASC on our congressional visits, have been advocating that some of that money would go to getting a couple of those tablets that, as you said, would be sanitized in between uses, but for the residents' use for telehealth.
So it's here, so it's 2,000 base amount per property plus $60 per assisted unit. So it certainly could go above that. How much more above? I guess we'll find out over the next couple of weeks.
thank you. Okay, so we have some scenarios for open discussion. A big one that we are finding is residents refusing to wear masks. So we kind of wanted to pick everyone's brain and see how they're managing that at their properties. If you have any suggestions, you know, just feel free to jump in and share with us what your property is doing, what you're doing, what ideas you may have. Because we're also working on a protocol for our properties on how to guide service coordinators, how to talk to residents and have these difficult conversations with them, and using different strategies from, you know, public health, education theories to social marketing. So we just wanted to kind of talk about that and see what everyone else is doing and how they're dealing with food distributions, with food pantries, if you're doing door-to-door delivery, if the community rooms are open for people to come down and pick canned goods, or, you know, if anybody wants to jump in and share what they're doing.
Well, I'll jump in and get it started. How about that?
Sure.
Some of our weekly check-in calls, this has actually been a big discussion, the masks. And I think we've got a chat. I'll read their comment, but a lot of places, locations, luckily they have, it's become kind of a moot point because cities and states, I know my city just came out with one yesterday, but a lot of the cities are now mandating them. So now they're not, you know, management isn't the bad guy, and that was part of the problem. And keeping people compliant. And also, I think some buildings, they've worked with family members to make sure that they understood that the resident needs to be compliant. So let me read the chat, and then please feel free to talk about it. Okay, so this is Lords says, masks were provided for each resident. We have signs asking them to all wear the mask when leaving the apartments and upon entry to the building. Another person wrote, we're doing our third delivery of masks tomorrow. And I know HHS, most of our buildings were able to get masks for free too. Okay, so, all right, Queens, New York. Residents are compliant with wearing masks. New York, I mean, that was one of the early epicenters. We also have masks at the front desk, so if a resident or visitor isn't wearing one, concierge will give them a mask. And I think a lot of buildings are doing that, aren't you?
Yes, we even have some buildings where they have sewing groups, and these ladies are getting together and sewing masks for the residents.
Mm-hmm.
But despite all of that, we're still finding some properties are still struggling with getting some residents to comply with government mandates even, or city ordinances. So, you know, we just wanted to kind of let everybody know a few tips. And of course, you know, you can't address everyone the same way, and just try to kind of have a private conversation with the person and try to understand their individual beliefs. You know, do they believe they're susceptible to the disease, and do they understand the severity of the disease? Are they aware? Do they understand the benefits of wearing a mask? Maybe not just to themselves, but others. With Tonya, we were kind of thinking, you know, a lot of the residents are very attached to the service coordinator. So could it be like, you know, do it for me, protect me from this virus while you're in the building by wearing your mask. Also understanding the barriers of some of the residents, you know, what's keeping them from wearing a mask? Do they not have one? You know, how they feel about it? And another important aspect was to, if they believe they can successfully commit to wearing one. So identifying all of these beliefs and how they feel about mask wearing is important also to address it on an individual basis. And sometimes, despite our efforts to educate residents and understand their beliefs, they still refuse. So another good thing to do is to have some positive reinforcements for those that are wearing the masks. Kind of if you see them in the hallway wearing one, thank them for it, or putting out in the newsletter just to kind of keep that momentum going. Let the residents know that you appreciate what they're doing to try to keep everyone safe. Because everybody's at different stages of behavior changing and trying to adapt something new. So, just trying to find out if they're going to take any action, where they're at, about thinking about wearing a mask. Maybe they're interested in knowing where they can get one, or have they taken any additional steps that might help them kind of adapt to new behavior. So, it's a good way to just kind of keep that going for the ones that are doing it and thank them or do something special for them. And, like we were saying, we're trying to do kind of like a social marketing approach here. We're working on that protocol at the moment. And, with marketing, it's not just about the product that you're trying to sell or the service. Marketing, the purpose is to influence behavior. So in this case, behavior would be to wear the mask. Try to get them to understand the benefits, or negotiate with the residents. It might be about, it's my choice to wear one or not. And, we understand personal freedoms, but at the same time, you can negotiate with them like, okay, you do choose to not wear the mask, but is it worth it if you get sick and you end up in the hospital? Then you're going to lose the freedom to go out and about like you're doing now. Or try to get them to commit to at least wearing it while they're in the building and not exactly enforcing it while they're out in public, shopping or visiting friends. Try to get them to agree to like a middle ground, and your residents better than anyone else. And given that you're inside the building already, it might be a little bit easier to reach them as opposed to other health professionals that are trying to change behaviors outside in the community. So just kind of, take that into consideration as a benefit to kind of help this. But yes, most people are compliant, but we are seeing some cases where people are just not, and kind of convincing other residents to follow the same path. But we just wanted to know what other properties were doing.
That's really all that we prepared for today. I think when it comes to service coordination, I think the most valuable tool that you have in your toolbox is other service coordinators and networking with them. You guys have a great group here of lots of service coordinators. So, I would advise that if you don't know everybody, to get to know them, because I have found in my years of doing this, I was actually a service coordinator for 6 years before taking on this role. But whenever I needed something, other service coordinators were the ones that were able to help me the most, because they were experiencing the same things as I was. So with that being said, does anybody else have any other best practices that you have found to be successful during this time, working with residents during this COVID-19 pandemic, that you might want to share that might be helpful for anybody else? And don't everybody jump at once.
And also, I know as far as your question about the food distributions and food pantries, kind of an open discussion. A lot of our buildings are doing that. They have, and it's not just food, it's, toiletries. I always harp on toilet paper because that was that thing everybody was hoarding. But we have buildings that they were going out and buying toilet paper or getting it donated for all the residents. So, and other things that were hard to get. I know one building was even trying to figure out how to make hand sanitizer because they truly could not get any. So if anybody, I know, because I saw a lot on Facebook, our buildings in Tucson, both of them did a lot of going out and getting those basic supplies for the residents. Where did you get the money for that, and how was it distributed?
Hey, Janelle, this is Teresa. I know Luce did a lot of things, and I think in both of our parts, a lot of the help came from our board members. We had other people in the community looking out. Luce always finds all kinds of community partnerships. She shares with the rest of us. She's been a great help throughout this. I know I've continued to do our food boxes from the food bank once a month. Being the biggest building, senior building here, I have about almost 60 people that are on that. So what I do is I call them down a few at a time. I insist that they wear a mask and socially distance. I have them come in, grab their stuff, and go directly out the multipurpose room. And the same thing with the PCOA got COVID funds, and that's our local area agency on aging. And we've I think all of the senior buildings here have started the meals program through them. And I currently have 32 people signed up for that. So all these things have been really helpful. So we're making the extra time and making the extra commitment to do any of these programs. And there's also been through Jewish Family and Children's Services, they had some COVID funds also, and they're helping people with shopping services. They'll even buy the food for people who are having problems. They'll go get it and bring it to them. So that's been really helpful as well.
Okay, great. We had a comment on chat about social engagement activities during this person's from Boston, during their surge of infections and stay at home. They did a door decorating contest in April. I know another building, I think Schenectady, said that was really popular, the door decorating contest. Self-care bingo in May. I'm not sure exactly how they did that. I'm really interested in the phone bingo. That sounds pretty cool. Fitness challenge for June, and they did prizes. So I don't know, Julie, you want to tell us a little bit about that fitness challenge, how that went about?
Hi, can you hear me?
Yes.
Okay. We have a fitness coordinator on site, and that is her specialty. She did a whole program calendar, and each day had a different challenge, a little walk or exercise or something. And at the end of the month, you submit, and then she drew prizes, and the prizes were like a little gift bag of granola bars, pedometers, water bottle, things like that. It was very popular.
No, that's great. And I think the door decorating contest is great. Yeah, a couple of buildings have mentioned that. And I mean, I remember doing that in the dorms, when I was in college, how much fun that was. So pick a theme, maybe, I don't know, Labor Day weekend. I'm not sure exactly the theme for everybody. But I actually, again, on the Zoom check-ins that we've had, people have been so creative in some of the things that they've been doing. So I also wanted to mention, you all were talking, you mentioned free conference call. Is that actual freeconferencecall.com?
Yes, that's the one. That's the one we've been using. So they kind of assign you a phone number, and it's super easy. You just put out the flyer, tell the residents what number to call and the PIN number. So there's no video setup. That can be confusing for some. So it really worked out well when we did it. So I'm curious to know how the bingo went today. But it looked like a lot of people were interested. So.
And again, that's what Evan and I use and ask. We use our congressional calls usually. We use freeconferencecall.com because it's free. So you freeconferencecall.com. If you've never used it, you just go online. That's how we did it. And somebody, you get a membership, it's free. And then they assign you a phone number and a code, access code. And we found when we use that if you do it, say at like 1:15 or, 2:55 or something, don't do something like right at 3 or 3:30 or something like that. Doing it in 5 or 10 increments off of like what you would normally do, 3 or 3:30 to 2:30, do 2:55. You can get in easier because we were having problems with you know, people not being able to get in. So that's just one thing. There's a lot of free things out there. And I mean, we've never had a call long enough that we got kicked off or anything with freeconferencecall.com. So I don't know if they have a time limit, but we know probably being on the phone is an hour is probably about our maximum too. So I doubt you would overstay your welcome on it if you did one. So I know Candy Hatch in Fort Worth, Texas, she sent us pictures. She has a whole activities table. And Candy, you just want to tell about that real quick? It's activities for everybody to participate, but to grab and take back to their apartment.
Yes, I know. I was gonna like chime in a while ago and say this is how we wear our masks here. Like, I'm teasing. I know. So yeah, I have the I got it from the Activity Connection, and now we actually we do themes. So we had the one for 4th of July. It's actually still up, and I just try to keep puzzles, coloring pages, things like that that go with the theme of it. And then they have trivia that I do like twice a month right now. But I did just change up our board where we were doing the trivia, and we did positive thoughts. Went to Pinterest. It's been my friend for this type of thing. And I did a positive thoughts, and then there's, oh wait, I have one. I just forgot. I got to replace them all the time. We did, I don't know if you guys can see, and they can peel off the positive thought. And I've had to replace it just about every other day because they do come out for mail, things like that. But our residents are pretty quiet. We just have a group that are always out because, you know, they just don't do well. But I did want to tell you guys, we are getting ready on Monday to do, I don't know if you can see it, it's a scavenger hunt in their apartment. And again, Pinterest. And it's all household items. And they have 12 items to find in like 20 minutes. And the staff will be at the corners of the hall, so no one comes out. And there's no, you know, we keep our social distance. And we have like these little megaphones. And they are to collect their items and then yell at their door. And then, of course, the prizes will be wipes, love Dollar Tree, I found some, toilet paper, essentials like that.
That's great. Yeah, the megaphones, that's interesting. We need to know where to get those, how much they cost. And Candy, what I would really like, and this is a plug for our website, we do have resident activity resources on benebrith.org/seniors. It's on our main webpage for CSS, Center for Senior Services, seniors page. Or you can also click on our COVID-19 from there and you can access it too. So we've put PDFs. We would love to put your scavenger hunt as a PDF on that activity. So we've been trying to share those, and anyone that has those, please send them to Gracie, myself. But Gracie's more taking care of our website. She's kind of our convoy for that. And so if you have activities, send them to us because we'll share them with everybody. I mean, that's the point. So hopefully, you know, when you're sending them to us, we're going to share them.
Okay, I was going to tell you really quick. One of the residents came to me, and he's not one who really talks much. And so as of next week, our board will be thank you to our, you know, first responders, our heroes, because they all have children and they want to share that their children's a nurse or their son's a fireman. So we're going to have that board up there with a big thank you, you know, Pinterest, and then little cards that are pre-printed so that they can sign them, and then we'll send them to their families as a thank you.
Great. That's great. I know in my neighborhood, there's signs everywhere that have been up for a few months. Thank you to all the essential workers. That's what gave us the idea for our Hometown Heroes. I'm going to make a plug for that. Gracie showed the slideshow gallery. Again, please send us your hometown heroes, which are you all and anybody on your staff, anybody, you know, residents that are volunteering to help, whoever is making a difference in your building to get all the residents through this pandemic. Send us their pictures because we're going to put them on, we'll add them to our gallery. And at some point, we're going to make a video for everybody to share too. Let's see, Maria says she has a few tips if you want to do conference calls. So if you want to.
Yes, so we found that if you have resources you'd like to share, like phone numbers or websites, it's best to put it on the newsletter or the flyer advertising the call, because you can imagine how it will go with over 10 people on the phone trying to read a website and someone can't hear, trying to repeat it over and over again. So that took up a little bit of time when we tried doing it, and just establishing some ground rules from the beginning as to who can speak when and where, to let the service coordinator finish before they can interject. You know, we welcome comments and suggestions, but just kind of let her do her thing first and then comment. So just make sure you maybe put that in writing, whatever ground rules you come up with and whatever resources you want to share, just put it on the flyer as well so they have it. And even an outline of what the conversation is going to look like so they know to follow along, and you know, things that they're, you know, that you will be talking about. So we learned that from our calls.
Oh, it's good information. We actually had to start doing that with our freeconferencecall.com calls to your congressional offices. We generally have everybody introduce themselves. You know, with a smaller group, you can do that and then kind of designate who's going to be the spokesperson, and everybody kind of waits for that person to pass on to the next person. So there's all sorts of tips. So yeah, conference calls, you realize when you do them, they aren't quite as easy as you think, and especially the more people you have. Thank you, Maria. Okay, does anybody have any other comments or questions for Tonya and Maria or Melissa? Okay, I mean, it was a lot of information and really good ideas. It made me think, and that's the thing, you start thinking about stuff and it's like hours later we come up with questions. But we had a lot of comments too, and thank you all for using the chat. I think that's helpful too. So we had a lot of good comments. I've been taking notes. So I think one thing we're going to do is one of those Zoom check-ins that we have in August. We probably are going to talk more about some of this and kind of facilitate a discussion again, seeing if anybody has used any of the resources and done, especially the phone bingo, and some of the creative things that you all are doing to do activities for the residents, and also the assessments, trying to figure out what's going on with your residents. Because I mean, we feel like we're going to be in this for the long haul, right? We hope we're not, but we're going to be realistic, right? So, and dealing with, unfortunately, what we're seeing right now in some of our states, and I know Arizona was one, California, I believe, just surpassed New York in infections. So, I mean, states that actually had seemed to have a peak and then we're doing okay are now having second peaks. So we have to be prepared. I'm always like proactive. But I think that's the great thing about this network too, is sharing everything that you're doing. And we know it doesn't get any easier, whether you're the manager, assistant manager, the service coordinator. You all are really sometimes flying by the seat of your pants with all of this. So we really appreciate everything you're doing. And I really appreciate Melissa, Maria, and Tonya sharing a lot of this information, because it really was, I think, valuable, very valuable. And based on the comments and the chat, everybody really gets it. And we really appreciate you all taking the time to put together presentations for us. Okay, last call for comments or questions. And again, any questions you ever have, send them to us. If we can't answer it, we will find out who can. We definitely have a good relationship with AASC. Yay, thank you. And certainly with Tonya and Maria and anybody that works with supervising service coordinators too.